seconds to turn up. Brilliant. So welcome this afternoon to this Enhanced Practice webinar for employers and providers of occupational therapy services. Great to have you join us. I'm Claire Guyett. I'm an occupational therapist and I'm Practice and Workforce Manager here at the Royal College of Occupational Therapists. And I'm joined today by three fantastic speakers. We have Sahila Mohammed, who is our Head of Practice and Workforce at the Royal College of Occupational Therapists, and Dr. Kim Stewart and Louise Henstock, who have worked together in partnership to create the Enhanced Practice curricula and schema for occupational therapy, which we will be learning about during this session. Now, as some of you may have noticed within the diary invite, this session is being recorded, and this is because it will be shared on the RCOT website. So for those of you who would rather not feature in the recording, then please do feel free to turn your cameras off. We also ask you to keep your microphones on mute throughout, just to help with the quality of the recording, please. But we do welcome you to use the chat function, so please add in there any questions, reflections, or thoughts as we run through the session today. And there will be an opportunity towards the end where we can come back in to ask any questions and use the hands up function. Can I just ask you all to pop yourselves on mute, please? Lovely, thank you. Just to give some context, this is the second of a three-part Enhanced Practice webinar series. So last Monday, we have had an Enhanced Practice webinar for higher education institutions, and that can actually now be accessed on the RCOT website if anyone would like to look back at that information. Just pause if people could mute, that would be great, please. Thank you. And then today we have our Enhanced Practice webinar for employers and providers of occupational therapy services. And as mentioned, this will also be recorded and uploaded onto the RCOT website. The idea of these two webinars being recorded is that so people who aren't able to attend today can catch up, or if you'd like to go back and recap on any information, ready for our final session in the webinar series on the 24th of June, which is a wider question and answer session, and you're all welcome to come back to that, and anyone else who hasn't been able to make the session who may like to listen to the webinars ahead of time to come prepared with some questions. Now, moving on to today's webinar. Just ask if anyone joining can mute, that would be great, thank you.
There, you're on mute.
Oh, thank you. Has that just happened now? Yeah, sorry, I'll start this slide again. So today's webinar is for anyone interested in embedding enhanced practice occupational therapy services where you work. So you may be a leader or manager of occupational therapy services or part of an education team perhaps. We have two main aims for the webinar. Firstly, to introduce you to the enhanced practice schema and curricula. And secondly, to consider what enhanced practice means from a service and employer perspective. So our agenda is shown on the right-hand side of the screen. So shortly, I will hand over to Sahila Mohammed, who is our Head of Practice and Workforce, who will help us set the scene and consider how enhanced practice embeds and aligns with the Royal College of Occupational Therapists workforce strategy, which has recently been developed and published. We'll then hand over for the main body of the session to Dr. Kim Stewart and Louise Henstock, who will take us through the curricula and schema for occupational therapy, and at the end of this section we'll have the opportunity for some audience questions if you have any questions or thoughts that come up through the session. And then we'll hand back over to Sahila Mohammed, who will reflect on the session and offer us some key take-home messages. So without further ado, I will now hand us over to our wonderful Head of Practice and Workforce at the Royal College of Occupational Therapists, Sahila Mohammed. Thank you.
Thank you, Claire. That was a very, very kind and fantastically set introduction. I'm just going to orientate my screens and share slides. But good afternoon, everybody, and welcome. We are, as Claire said, really grateful that you're here today and you've prioritised being at this event. My name is Suhaila Mohammed. I'm an occupational therapist. I work at the Royal College of Occupational Therapists as the head of practice and workforce. And similar to Claire, I really want to start by acknowledging some key people without whom today's event would absolutely not have been possible. So first we have Claire Guyett, Practice and Workforce Manager at the RCOT, the orchestrator and anchor of this three-part webinar series. We've got Dr. Kim Stewart, Associate Professor and Occupational Therapy Curriculum Lead at Coventry University, and Louise Henstock, Directorate Lead for Learning and Teaching in the Allied and Public Health Directorate at University of Salford, trying not to trip over my words. And supporting the chat and keeping gremlins at bay today is Kinza Ahmed, our very brilliant practice and workforce assistant at the Royal College of Occupational Therapists. Now, we'd really love this session to be interactive with your questions, comments, reflections and reactions, so please do keep them coming as we go through today's content. So we here at the Royal College have a vision. We have a UK-wide vision for the occupational therapy workforce come 2035. And that vision is for an expanded occupational therapy workforce that is positioned to have maximum impact in improving people's health and quality of life. What that means is that by 2035, we hope to see an occupational therapy workforce that is confident and able to champion inclusion. A workforce that's fostering people's sense of belonging, whatever version of their world that is. A workforce that is based primarily within communities and supported to thrive within community and primary care settings. That support really looks like having adequate supervision arrangements, competitive employment terms and conditions, and visible career pathways for those who choose to work within community and primary care settings. A workforce that's positioned within our health, social care and education systems that's focusing on prevention, preventing the onset of disease, preventing the onset of deprivation and distress. And if we can't prevent the onset of disease, deprivation and distress, we want to be keeping people well and prevent any escalation in their needs. Because if we do that, if we keep people participating in the roles and routines that mean the most to them, then we reduce people's experience of health inequalities and we reduce the increasing demand for emergency, crisis and acute services. And finally, in terms of our vision, we'd like to see an occupational therapy workforce that very proudly has occupations at the forefront of its practice. A workforce that's very clear about its unique value and contribution, and therefore clear about its professional identity. And that's why, as Claire mentioned, on the 21st of March, we launched our first ever UK-wide occupational therapy workforce strategy with an action plan for its implementation across the United Kingdom. If you're yet to read the strategy, if you just chuck in RCOT OT workforce strategy into your browser, into any search engine, I think one of the first hits will be the webpage that you see on the screen. And I trust my colleague Kinza will share some links in the chat as well shortly. Now, when you go to that webpage, you will find the strategy in full. You will find an at-a-glance summary for those very busy people. You will find an action plan to embed the strategy across the UK. A bibliography, a glossary of terms which people might find helpful, a version in Welsh for those who are bilingual, an audio version, and a facility to request an accessible version that suits your learning needs. And because of devolution, because health, social care, education, and other government functions are devolved to nation-specific governments, it made sense that we develop action plans to implement the strategy in each nation's context. So by the end of June, we'll have published a Wales action plan, and then by September, we'll have an England's action plan, and following Scotland and Northern Ireland's too. So please watch this space for future action plans. Now, there were, and they still are, lots of reasons why we needed to publish a strategy, and the slide in front of us details some pretty sobering statistics that highlight why we need more of us to be meeting the growing demand for our services, and also where this growth in demand is coming from. And the growth in demand, quite simply, comes from an increasing number of people who are living with multiple morbidities. That's people living with more than one long-term condition. And generally, those long-term conditions span people's physical and mental health. And therefore, we have more and more people who are presenting to our services with increasing complexity and need. And as I say this, I'm very much aware that I'm preaching to the converted, the people who absolutely see this on a day-to-day basis. And we'll all know that these long-term conditions over time reduce people's participation in meaningful life activities. They reduce people's participation in work or in their productive life roles, in their ability to care for others, in their ability to satisfy those roles and routines that make them feel like they have a place in society, and therefore impact their sense of inclusion and their sense of belonging. More than that, though, all stats aside, we at RCOT needed to publish a strategy to really give direction at a time when many occupational therapy practitioners were telling us that they're experiencing a crisis in professional identity, that they were and they still are overstretched, underfunded, and generally exhausted by the pandemic. And they continue to feel exhausted because of the austerity that's followed the pandemic. And what we're going to hear today is how enhanced practice as a level of study, as a level of practice, offers employers, offers providers and practitioners a solution to many of these systemic challenges. So over the course of about 2 years, we engaged with the occupational therapy workforce through a series of workforce summits. Some people on this call might remember attending them. We had an education summit, we had a workforce survey, and again, if Kinza will drop a link to the workforce survey from 2023, and we consulted international stakeholders like the World Federation of Occupational Therapists. We consulted national and regional leaders across the 4 nations of the UK, leaders of statutory services, leaders of charities, social enterprises, and owners of private and independent provider organisations. And we did this to really understand the full range of employers and providers of an occupational therapy service and employers of an occupational therapy workforce. And finally, we consulted with government departments across the 4 nations of the UK and those government departments who had a responsibility for workforce particularly. We scooped up all of that intelligence and insights and produced our first ever UK-wide workforce strategy with the action plan for its implementation. Now, when you come to read it, and for those very busy people, the strategy does 2 main things. It has 2 main messages. The first, it lays out the argument for why we should grow as a workforce, why we should be based mainly in communities, why we should be focusing on preventing the onset of disease, the onset of deprivation, and the onset of distress, so that we can sustain our healthcare systems and economy. Because if we're based where people normally live, we start to chip away at those layers and barriers that referrals impose between people or populations and us as a workforce. And really, that is what's going to make it easier for people to access us when they need us, where they need us. And the second thing the strategy does is that it highlights several areas and opportunities for us to grow within, areas that afford us the most opportunities for us to flourish, the most opportunities for us to expand and to be leaders within. Those areas are listed on this slide in front of us, and the more and more times I deliver this presentation, the more I realize just how interdependent all of these 7 areas are. And the more I hear Kim and Louise speak, the more I see the potential for enhanced practice as a key enabler in helping us achieve the vision of our strategy. So how are we going to achieve this vision? And to put it simply, we're going to achieve this vision through a series of smart actions that are categorized under 4 workforce priorities, and I'm going to speak to each of these priorities in turn. And Kinza, I think, will be dropping a link to the action plan in the chat as well. Now, the actions in our action plan are commitments. They are commitments over things that are either in our gift to control as a professional body. And I say this because professional bodies don't really have regulatory power. They don't have enforcement powers. We can't really make people do anything, whether you're an employer or a practitioner, but we absolutely can influence. So our actions are over things that are in our control, such as the reach and the engagement with our members. or they are over things that we can influence through the right institutions, through government bodies, and through employment settings by working in partnership with people on this call today, as well as our education providers. So rather than read the descriptors on the slide, what I'm going to do is I'm going to provide an example of the actions that we've either taken or are currently taking under each category relevant to enhanced practice. And the first category of our workforce priorities is optimizing occupational therapy. And an example of our smart actions under this category is to highlight to employers, arm's length bodies and government teams the value and the impact of occupational therapy practitioners who are working at enhanced, advanced and consultant levels of practice. We've committed to under this category that by 2027, we will ready employers and providers of an occupational therapy service to grow, to retain an upskilled occupational therapy workforce that is studying and practicing at enhanced, advanced and consultant levels of practice. This three-part webinar series, which we're starting today or this year in 2024, is one of the ways in which we are delivering on that action. Our next workforce priority is demonstrating value and impact, and the smart action that we're taking here that supports the spread and the adoption of enhanced practice is from this year, 2024, we're going to be working with regional and national leaders across our pillars of practice to build on workforce transformation conversations that we began back in 2022. Since I started in my post here at RCOT last April, we've co-delivered 6 workforce reform workshops, and we have 4 more planned for this year. In May, thanks to Claire and the team, we co-delivered a workforce reform workshop with Skills for Care and the Principal and Strategic Occupational Therapy Network in England. That was a workforce reform workshop for the occupational therapy workforce within social care, and I'm in the process of convening planning meetings with our members for a national workforce reform workshop on an outcome measure for the profession and another one on the role of occupational therapy practice in acute and community settings. And the idea here is that these events will build on previous year's workforce summits, and it will build on the pledges that were made at those events and the pledges that were made to attract, to grow, to reform and to retain the occupational therapy workforce. Under the next workforce priority, retention and career development, a key smart action we're taking here that's relevant to enhanced practice is to review and to update our career development framework. This work starts this year, and it will have a focus on helping employers and providers of occupational therapy services to support their workforce to really embed the career development framework into our day-to-day practice. What we want with this action is to support practitioners to self-actualize at the career level that they want to self-actualize at. And we want them to be able to access the support and the investment that they need to be the best practitioners that they want to be. And finally, we're going to achieve our 2035 vision through a series of smart actions that support effective workforce planning across the United Kingdom. And this is where our Innovation Hub becomes our hero. And I think there's a link coming through in the chat too. Now, our Innovation Hub, which went digital on the 29th of April, is really our platform to gather and share examples of our workforce models and workforce skills configurations that are having improved outcomes or leading to improved outcomes for people, for teams, and for the systems. When people submit to the Innovation Hub, we have a ninja team behind the scenes that analyzes all these submissions and then shares the learning on this digital platform from the improvement journeys so that others can do the same if they meet a similar challenge or an opportunity within their own teams or systems. But for us to be able to do that, we need people to be submitting their improvement journeys. This slide I'm not going to spend too much time on. It really just kind of captures the examples that I've just shared. I thought for those who are not able to join us today, it might be helpful to see the example actions on its own slide. And here is my plea. Many of you will have seen the news of our funding opportunity for up to £5,000 for innovation ideas and projects. This opportunity for funding is open to all of our members of the occupational therapy workforce, including those who support different learners, different career levels, and also those who support multi-professional teams too. The submissions to our Innovation Hub take around about 15 to 30 minutes. It's super quick and super easy. If you're not a member of our RCOT and you're listening to this and it interests you, if you can find a member within your team or within your system, they might support you to put in an application for some of this funding opportunity. So please do spread the word, tell your colleagues, tell others in your team, and we really encourage applications for the funding opportunity. Or if you're already in the middle of an innovation project or ideas, then please submit to our Innovation Hub. The applications opened on Monday the 29th when we went digital, and they close on the 30th of August, but they might close before, once all of the funding sort of pot has been allocated to different applications. So please do not miss out. I think that's everything from me. I feel like I'm coming up to time. I'll be back later for some closing remarks. But thank you guys so much. Thank you for being here today. Thank you for uniting behind our vision, which is for an expanded occupational therapy workforce that is positioned to have maximum impact in improving people's health and quality of life. And thank you, of course, for taking action with us. Simply by being here today, you're part of the collective action. And I'm now going to hand over to Dr. Kim Stewart and Louise Henstock to tell you all about the magic of enhanced practice for yourselves as employers, providers and practitioners. Louise and Kim, over to you. Thank you.
Thanks, Suhaila. Oh, sorry, my voice went then. Thank you, Suhaila. So welcome. Absolutely fantastic to have you all here. I was like, let's get to 100. Can we get to 100? So call out to you, go grab a friend. Let's get to 100 on this webinar. Great to be with you today. My name is Kim Stewart. I'm an occupational therapist by background, and I'm one of a duo with Salford University, who's been leading some of the work around the development of AHP enhanced level practice. So I'm just going to share my screen, and Louise will introduce herself too.
Thanks very much, Kim. And I just want to say and reiterate Kim's words there. Thanks for attending today. It's really great. And we're so delighted to be sharing this journey of enhanced practice with you. It's a really exciting opportunity for us as AHPs to really celebrate and support that middle workforce, and thanks for Suhaila for setting the scene there. So Coventry University and Salford University as HEIs went into partnership, an innovation partnership, and were fortunate to be commissioned to explore enhanced level practice across 7 AHP professions, one of which was occupational therapy. And so we're really going to do a bit of a dive today and explore enhanced level practice for occupational therapy and talk about the schema and curricula that we've developed, that Kim and I have led across the nations. So we're going to talk about, this has been commissioned by NHSC, but we've made sure that our documentation is inclusive across the nations. And we're going to start off by talking about the hallmarks and our development of the schema and model curricula, because it's been a real journey and the shape of enhanced practice has changed. We're going to talk about the outline considerations for education providers and the domain. So going through that, the nitty-gritty of some of the paperwork that is involved, and talk about the implications for occupational therapy and development of the workplace and what that might look like to you as employers, and the considerations also for the intersection between enhanced and advanced practice, really thinking about the career journey as an overall picture. Next slide, please. So thinking about the evolving journey, that intersect of mastery and expertise across the nations, what are the hallmarks of enhanced level practice? And one of the things that we started off, Kim and I, by identifying was in the original documentation was this was described as enhanced clinical practice. And what we really wanted to do was actually remove that clinical practice. We can't do it from the apprenticeship, but it's remove that in terms of the documentation moving forwards, because what we absolutely need to do is see the 4 pillars of practice in synergy. That's really important moving forwards, that as AHP professions, that we need to develop across those 4 pillars. This is about a level of practice that demonstrates depth of knowledge to support complex decision-making, clinical competence and judgment within a specific area of practice. And again, that's really important. What we know has happened previously in advanced practice is that we have some generic roles and the generic framework. And what our remit was here was to absolutely embrace the core principles of occupational therapy and really, and across all AHP 7 professions, but really get into the nitty-gritty of what makes an occupational therapist special in what they do and what they can deliver and their impact on the workforce. So really looking at that within that area of specialist practice. We know we're autonomous professionals, and that leads to expertise and expert judgment within that specific area. So this is looking at occupational therapists moving beyond preceptorship, going into that middle area of workforce, and that can be a destination in itself, or it might be as part of their career journey moving on to advanced practice. It's about criticality and thought, and action, in using evidence to inform practice. So again, thinking about across all 4 pillars of practice, thinking about research, embracing that research pillar. We want to develop future researches in occupational therapy. Evaluating approaches to interpret and synthesize information within complex situations in practice, and thinking about situational leadership, including without authority and through influence. So again, thinking about who are our leaders of our future in our occupational therapy workforce. Next slide, please. So what is the enhanced practice curricular purpose? It's to absolutely maximise allied health professionals. We are autonomous in our practice, and it's to maximise our potential for that workforce, to be values-led at all levels of practice, to be inclusive of all. And when you have a look at the documentation, which I've just popped a link in the chat there for you, that's the web page that has all the links in it. You'll see within the documentation there's a separate section that Kim and I really felt strongly about to include, which is the equity, diversity, belonging, inclusion. So really making sure that that's sung through the curricula to make sure we're inclusive of all the workforce. To be multi-professional intent, but celebrate clarity and depth of practice in profession specific. So what that means is there might be some areas of practice where AHP sit together and are experts in a particular field of practice, but it's absolutely about singing to that professional lens. So ensuring that occupational therapy sings through all that is done in enhanced practice. To be agile in design across health and social care. So again, we were very conscious that this document needed to be agile and move with the workforce. We were asked to identify priorities, and Kim's going to go into those, but asked to identify them now, we know that they're going to change. So it's very much examples of things that are happening now, examples of professional pathways, but those can change with the workforce needs. To commit to transformational change at system, place and neighbourhood levels. That's a very English-centric description, but we're very conscious of this as we wrote the documentation. We need this to run across all nations, and it is inclusive. To be aligned to educational frameworks and curricula. We heard about some of the Royal College of Occupational Therapy career frameworks there. We've been included in discussions with all professional bodies and had national stakeholder events across the country too, and make sure we are including all frameworks that are currently published. And we've mapped the documentation so that not only it maps to the apprenticeship standard, but it also maps within each profession to existing frameworks. To be cognizant of professionals' career journey from registration to advanced level of practice and beyond. And this was something we identified very early on in the journey of developing the enhanced practice curricular purpose. And that was because we were conscious that it needs to sit amongst other things that are already there. So we very early on identified that we needed to make sure that this dovetailed into a career structure that went on to advanced practice, if that was something that people wanted to do. And Kim and I are also involved in a board that is currently writing a position statement on advanced practice, and we'll go on to talk about that a little bit later. And to be employer-led, to grow and sustain the local workforce. And this is why we're so delighted to see so many of you here. Have we tipped yay, we've tipped 100. Okay, so we're so delighted to see so many of you here, because actually it's you who are important. This is about you and us working together. This is so important that HEIs work with the local workforce to ensure that what we produce at HEIs is representative of the community and what the workforce needs. This has got to be employer driven and employer led. So absolutely fantastic to see you here. And on that positive note, I'm going to hand back over to Kim.
Thank you. So I'm going to walk us through the deep dive. Please feel free to ask questions in the chat. We will pick them up at the end, and we'll probably be able to answer them as we go along. So just to give you a scope and an understanding of what we did, we worked through an innovation partnership, and that partnership included employers, it included practitioners at all levels of practice, and a real diversity of people were part of the process of development. We held a number of stakeholder events as part of that, and really focused down on what the priority areas were for occupational therapy at this moment in time across all sectors and nations. So this is what comes out in the document. So when you look at the schema and the profession-specific curriculum, it really is about maximising these areas of workforce as a starting point. It doesn't mean we are stuck to this as we move forward. It should evolve as we evolve as a profession. And you should see them some synergy in terms of the workforce strategy that we have at RCOT, as well as what we're doing here in terms of enhanced practice. So what we're looking at and what the curriculum really drives forward is occupational therapists' role in health promotion across all sectors and across all areas of life course. Really, it's about how we contribute to enabling people to manage their own health and well-being and look at that social justice framework in which to empower others. It's around social care, using a strengths-based approach, using digital technology, all sorts of kind of innovations in how we support people to live at home and be connected to their communities. A real focus on urgent and proactive care to facilitate early and effective support to people to remain at home or return home. And when I talk through this lens, it is inclusive of all sectors. So there isn't necessarily a distinction in here between mental health and those that support physical health needs. This is about saying we need both elements of those workforces working forward to support people to remain or to support them to return home. Lots around this whole prevention and primary care workforce. So how do we mobilise that workforce to contribute to addressing health inequalities within our society? What do we have the role in occupational therapy about supporting people to either return or remain in work? And you'll see the whole kind of government drive around that recently around the Fit Note, and there's some convened work from RCOT going on to support it. Very much about how do we take forward and really capitalise on the value and the impact of occupational therapy and mental health. The same with thinking about children and young people. We know that there is a SEND crisis. We know that there are real challenges in how we support our young people to thrive. So how do we make that transition in education and adulthood? And then lastly, it's about, so how do we build that evidence base behind what we do within occupational therapy, that we can articulate really clearly what the outcomes of our interventions are and the value that we bring across an individual and a system and a health economy, thinking about that social value that is important to occupational therapy. So what we did was we used that as the basis to develop our enhanced practice curricula. As Louise said, this is developed across all 4 pillars because actually it's the recognition of those 4 pillars in synergy that brings that strength in the workforce. How do you have those conversations that are challenging, that are difficult, that require you to work within complex situations? You need all of those pillars to take that to the fore to enable you to make that impact. So it brings together education, research, leadership and clinical practice. Each pillar has specific domains which are mapped to the apprenticeship standard and any profession-specific frameworks that are relevant to occupational therapy. So we built 10 common domains and they rest across all allied health professions. So within our partnership, we had 7 curricula that we developed, and there is synergy across enhanced level practice. But also it's about recognising what are the profession-specific domains we need to mobilise and take forward in order to bring about that occupational therapy impact. Within those domains, each domain has 3 descriptors of enhanced level practice. The first one is a capture of what does it mean to work at enhanced level practice for all professions, AHPs alike. So what are the hallmarks of enhanced level practice? The second set of descriptors focus on, so what does it mean to work as an occupational therapist at enhanced level within that domain? And then the third level descriptors are where we capture the pathway specific domains. And that's where we're looking at those priority workforce areas. What would a structured development programme need to address in order to demonstrate that investment in our workforce, that growth of our workforce around enhanced level practice? So these are the common 10 domains. So as you can see, there is absolute parity in terms of those 4 pillars. Clinical practice, leadership and education and research are all present. So this is about developing all elements of our workforce. It's about developing practice educators. It's about developing clinical academics. It's about developing really high quality occupational therapists who have that opportunity to work in different ways throughout their career. Now, the occupational therapy specific ones, and these were reflected from the workforce priorities from all of our stakeholder groups, is the 2 domains that were created. The first one was around occupationally focused approaches, right from assessment all the way through to evaluation, and how they use evidence to underpin professional reasoning. And again, we're moving away from talking about clinical reasoning. We're talking about this could be about driving our profession no matter where they work. So that intersect of professional reasoning, drawing in different perspectives. The second one is around health inequalities and occupational justice. So being able to articulate the significance of occupational justice in addressing health inequalities. And that's bringing that social frame in here. How do we make an impact on addressing health inequalities? How do we change the state of our nation, and how do occupational therapists contribute to that? Having a really strong ability to articulate it shows the value that we offer right across that middle point of the workforce. And then as they become leaders and grow in their profession, they will take that with them and really pull forward what it means to be an occupational therapist and the outcomes that we deliver within our profession to the communities that we work with. So they're our core domains. They're the things that celebrate occupational therapists working within enhanced level practice. We built specific pathway descriptors as well, recognising those workforce challenges. So the first one is around community-based rehabilitation, and that is across all sectors. It includes mental health, social care, it includes statutory, voluntary sector, independent practice. So it is for all. And we thought clearly and carefully about articulating what it is that occupational therapists would be working towards at enhanced level, should they be working within a community-based rehab space. Urgent and emergency pathways to support people to remain at home. Again, thinking about what it means to be able to add value as an occupational therapist at that level of practice. Mental health, primary care, which includes community-based support and support in care homes as well. Social care, and then children and young people. So in terms of how will this be delivered, and some of the principles that we've suggested to our HEI partners across the sector, is actually this should be a synergy of 3 things. Work-based learning should come first and foremost. And work-based learning is really about that application of theory and practice within their employment setting. Whilst we're talking about apprenticeships here, actually that reflects no matter what nation. If we are supporting people to take part in structured professional development, it's about what goes on in the workplace being just as vital, just as valued as what happens outside of the workplace. Now, in order to deliver that sort of curriculum intent, it's about working collaboratively. So having ongoing work-based mentors who can provide that support to our workforce in taking part in this structured development, maximising that sense-making experience and being able to assimilate what it means to work at enhanced level practice into their daily work practice. The university-based learning is about really that collaborative space for people to come together, debate and appraise theory, look at new ways of working, look at evidence-based practice, and really bring together that environment in which they can test out these skills, capabilities, and knowledge. And then the final thing, and this is particularly pertinent for the apprenticeship, is occupational competency. Now, if you take away apprenticeship language, what that means is that they can demonstrate they are working at an enhanced level of practice. So being really clear that they are able to demonstrate that level of skill, that level of competency with those subject-specific, professional-specific knowledge, skills and behaviours. And that may mean they will be supported by a variety of people in the workplace, including clinical supervisors from other professions potentially. So things to consider before we move into thinking about any questions that you might have. It's really important as we set out in working forward around enhanced level practice is to understand the component parts. So there is a distinction between academic level and practice level requirements within enhanced level practice. We're recommending in our schema that this is delivered at level 7 learning. Now that is exactly the same as advanced level practice in terms of the academic qualification. And really what we're saying to people is that doesn't mean it's the same qualification. What we're saying is the academic skills sit at level 7 and that's the benchmark quality, but the practice level requirements are really quite different. So thinking about what will enhanced practice look like in your organisation, how will you make sure it's distinct to advanced level practice, and understanding how you will navigate that with your providers of education to be clear about the distinction. There is work going on, as Louise said, at a national level with our the Enhanced Practice Board, providing some further guidance about the distinguishing elements between advanced and enhanced, between the level of practice and the level of academic study. In terms of particularly for an apprenticeship mode of delivery, but for our colleagues across nations, work-based learning, kind of insert that in terms of if you're looking to support this within the workplace. Thinking about work-based mentorship and what would that look like as your offer in supporting enhanced level practice. This is a triad approach: occupational competency, work-based learning and the university. And really it's about how do we build that educator workforce to be able to support through mentorship. Thinking about that learning will happen in the workplace alongside the university. So what access to learning opportunities within their role and beyond their role can be created. And that doesn't mean a day a week. It means what experiences can they take in order to grow within this enhanced level of practice. Thinking about clinical supervision and who will be signing off occupational competencies. Within the apprenticeship standard, as an employer, you sign off occupational competencies, not the university. So thinking about how do you build that knowledge and expertise to sign off what enhanced level practice looks at, and how will you work with the education provider to do that? Ensuring that anti-discriminatory approaches are absolutely built into all of this, ensuring that any assessment of occupational competency is fair and is unbiased. And thinking about access to those training programmes, we already know there's a distinct lack of representation at advanced level practice from different groups of people. Thinking about proactively how we address that at the start of this. And then what will your procedures be in terms of signing off occupational competence in the workplace? There's a big piece of work going around RPEL, which is where you accredit prior learning that, of course, you might have already done at a university and you're wishing to bring that into a new programme of study. Particularly important with apprenticeship delivery. And again, thinking about there is a difference between academic level and practice level here. So whilst you may be able to RPEL academic modules, the level of practice you cannot RPEL. And therefore, it's about thinking about it doesn't mean 1 year of an enhanced level practice will then move into another year and you'll be an advanced practitioner. We've got to really think carefully about what those transition points are. And then finally, the endpoint assessment. So as an employer, really important you recognise that this apprenticeship standard has a non-integrated apprenticeship. That means there is an endpoint assessment and you are equally responsible for enabling your employee to meet that gateway as the educational provider. So thinking really about how that final 6 months of a programme will dovetail into the integrated assessment for the apprenticeship. So that was a whistle stop through enhanced level practice and some of the considerations, but what we wanted to be able to do was really have the opportunity to answer questions that you might have. Louise and I are always happy to be contacted in terms of kind of any work going forward. So you've got our kind of contact details there on the slide, and I'll stop sharing now.